breaking that down. And that just reminded me, because I know many of you are going to be like, what in the world does your gallbladder have to do with anything? So like Shani said, your gallbladder is adjacent to your pancreas, to the tail of it. And they always say that the pancreas looks like a pear. It doesn't. It's too long for that. But but I guess the closest fruit you could compare it to in shape is a pear. So the tail end is like the narrower end of a pear, and your gallbladder is right next to it. And the duct that's connected to your gallbladder that is responsible for getting rid of waste, where your bile comes out, so your bile duct and everything, that gets stopped up if a tumor is sitting on the pancreas, or if you have pancreatitis, which anything with itis on the end means inflammation. So if your pancreas is inflamed, then it's going to block that bile duct, and it's going to prevent anything from passing to from the gallbladder and emptying out as it's supposed to. That's the other symptom. I love the flow of this. If you have jaundice,
yes,
if you get jaundice, immediately go to the doctor. Now, jaundice can be caused by other conditions as well. We are simply sharing these symptoms to say, please pay attention to your body.
Right.
You never know what the cause is, but you want to go in there just well informed of what's happening with yourself, even though you don't know exactly what the condition is. You want to go in informed about yourself. You should know yourself better than anybody else. So when you go to the doctor, within the first 2 to 3 minutes, you're like Shani said, I'm having pain here. Always tell them it's a 10. Always. Your pain level is always a 10. Okay. You are dying. You may not actually be dying. And do not go in there telling the doctor that it's a 2 or it's a 5. Oh, it's about a 6. They're going to send you home with some medication. Don't do that. It is a 10. You can barely walk good. I mean, sell it. Become an actor. Okay. You are now a theater major. You've been upgraded.
And action. No.
Right. Sell it. You got to sell it, because that creates that sense of urgency. A lot of people are like, I'm going to urgent care. No, go to the emergency room and put on your theatrical shoes and get to work, because you got treated like it's life or death, because it could be.
It could be.
And if you're lax, they'll be lax. You don't want them to be lax. You want them to immediately put their thinking caps on and say, okay, what could this possibly be?
Right.
And then
you are your best advocate.
You are your best advocate. And that will also help you to navigate your 20 minutes that you have with them.
Yes.
And they'll put you on the calendar right away.
Of course.
Now you don't got to worry about them booking a follow-up and then not being seen for 90 days. Like, no, we need to get you back in here as soon as possible.
Mm-hmm.
Right? So with that being said, what's the biggest misconception you would say families have about why their appointment feels so rushed?
Ooh, I think being on both ends of it, I think I'm going to go to the ends of being a patient compared to being a nurse. I think that we feel like our appointment is rushed because at some point it could possibly be that way, depending on when you schedule your appointment, right? So if you have your appointment maybe later in the afternoon, maybe the doctor has, other things that need to happen after this appointment. Some of your doctors are also surgeons, so they also go into surgery after that. So they're kind of like trying to speed up the process. Also, the charting, because that's how the hospitals get well, I guess I'm flip-flopping between both sides. The charting portion of it, because that's how your hospital or your doctor gets paid for your visit, for everything that they gave to you or didn't give to you. So I think that it feels rushed because technically it is being rushed, but you can control how fast or how slow it goes, your appointment goes, based on the fact of how prepared you are when you go in. So being more prepared and utilizing your full 20 minutes helps you. But if you don't utilize your full 20 minutes, then you're kind of helping out the doctor, because that final question, you go in and they're like, "Oh, your labs look great. Nothing really to be concerned with. Do you have any questions?" That is the beginning of your. Well, actually, yes, I do have questions. I was looking at this and I was looking at that and da-da-da-da. Don't go and compare them with Google or anything like that. Listen to what it is that they have to say, because they actually did the work. They actually took the time to study and get the degree that you are actually, there for. So don't insult their intelligence by, your quick little Google search. But to be able to just have a conversation and start that conversation, so that way you can then understand what it is that's actually happening. So kind of like just what we went through real quick, as far as like where your pancreas is located, what's adjacent to it, what's connected to it, what these terms mean. So I could use a word like cholelithiasis and you're like, what the heck does that mean? But then I can break it down to you and tell you what it is. That is an effective 20-minute conversation, compared to just, do you have any questions? And you say, not at the moment. So now your 20-minute visit just went to 10 minutes, and now I got 10 minutes to go and chart before I have to see the next patient, or go take a bite of my sandwich before I go and have to see the next patient, because best believe patient B is already in the room with the nurse getting prepared, if not already done. And now that nurse has moved on to patient C. So now I got 2 more patients that are waiting for me after you. Utilize your 20 minutes by being prepared and knowing what it is that you want to ask, even if you have it written down, whether it be in your smartphone or whether it be on a piece of paper. And then jot it down. So at the end of the conversation, just like you're having a conversation. So when the doctor gives you his or her explanation, you should follow up with, so this means this. If I'm understanding correctly, this means this. This is my results. This is what we're going to do. We're going to follow up in X amount of time. Correct? Doctor says yes or no, or nope, you missed out on this. Now you ask them, did I miss anything? No. Okay. Cool. So now there's a mutual understanding on your care, because you are your best advocate.
I love that. I love that. I never thought to jot down and follow up with the clarifying questions to make sure that I properly understood. So I like that. So that means y'all need to adopt journaling. Have you a dedicated medical journal, especially for caregivers. Have a dedicated medical journal. Your loved one is already frantic, and you're frantic too, but you're going to be more sober minded because you're not the one with the diagnosis. So have a medical journal where you take all the notes, even when you're at home. Be paying attention to your loved one in addition to them having to pay attention to themselves.
Right.
So essentially, you're going to be an honorary doctor at your house, if you will.
Absolutely. It's like, we talked about in the last one. I paid attention to all of his symptoms, so I was able to go in and say, hey, this is what he's been experiencing. So like Ashley said, go in and, put on the theatricals. You also just want to be able to open up your book. When you bring out this little book with all the documentation that you have, your doctor's ears go, whoop.
Yeah.
So now they're listening to everything that it is that you have to say. And if you are waiting for a period of time, give it to the nurse. Give the information to the nurse. Have it written down or, in your book and they could set it on top of their computer. So all of this stuff should be documented in your chart. For instance, I tell anybody, make sure that you are documenting. I had a family member who was battling some hypertension, and what I did, and blood glucose, as a matter of fact. And they told him that he was borderline diabetic. And I instructed him, well, what's your blood sugars ranging? Are they having you check your blood sugars? He's like, well, no, but they gave me the little thing. I just don't know how to do it. So here I am over like the little glucometer. Here I am literally instructing him over the phone on how to do it. Well, you got to do this, clean your finger, make sure you wash your hands, all of these other things. I said, now what I want you to do is I want you to check it. And not only are you checking it, but you're also going to write it down. You're going to write down what it is. And I believe that they have put him on metformin, which is a medication that helps to lower or stabilize your blood sugar. But if your blood sugar is within a certain range and you're taking metformin, then how do you know if it's working or not? If you don't go back to check your blood sugar after you've taken the metformin, how do you know if it's working or not? So not only did I have him writing down what his blood sugars was, but I also had him writing down what he was eating and at what time. So that way he could know, okay, for instance, let me make this make sense. If your doctor orders for you to take metformin at 9 a.m., we also kind of discussed this last time with the patient and their blood pressure and all of those other types of things. So they order you to take metformin at 9 a.m., but you don't eat, or you take it on an empty stomach, or they say, oh, just eat a little bite or whatever. You take it. If you're taking it, but you haven't checked your blood sugar prior to taking it, how do you know if this is going to bottom you out? So now you're feeling symptoms and you're just like, the first thing that we going to say is, I'm not taking that no more. I didn't like the way it made me feel. So now you stop taking your medication. And when you go and you just tell the doctor, I stopped taking it because I don't like the way it makes me feel, now you are labeled as non-compliant. Mm-hmm. Compared to, I took it, this was my blood sugar before, blah, blah, blah. Now your doctor has to give you what are called parameters. Don't take it if it's along this line, or if it's right here, don't take it. So you start to develop your own care plan, but you don't have that information. If you don't have that information, you can't share that with your doctor, because again, you're waiting 3 months before you even see them. So how do you remember what your blood sugars were 3 months ago unless you have them written down? And you could say, my blood sugar was 75 in the morning. I ate bacon and eggs. Then I took my metformin at 5 o'clock or whatever time, 2 o'clock. I took my blood sugar again, and my blood sugar was now 150. So now we're like, do we need to taper the metformin or whatever the case may be? You're giving us a guideline. You are showing us and painting us a whole picture so that we can then adjust or make the adjustments that are needed to, for you. Sometimes it could even be the fact of them saying, you know what? Maybe you don't even need that because it's keeping your blood sugar too low. But it all goes based on the fact of, like you're saying, having a journal, keeping a journal, and noting these things about yourself. It doesn't have to be a consistent, like, I'm noting everything about my body in the whole 24 hours. But it could just be like, hey, today, that's an unusual pain. Let me write that down. So when they say, when did that start? On this day. It started right. So you have, you can have the flow of the conversation, so that way it shows them whether this is an urgent need or if this is something that we can kind of monitor. Because now if it happened 2 weeks ago and you've experienced it for how long in the 2 weeks have you experienced it? Oh, I experienced it 4 times. Okay, that's a little urgent because it's happening more than it should. But if you say, oh, well, it happened just that one time in 2 weeks. Okay, let's keep an eye on that. So then if you go back in 3 months and you're like, oh, remember that pain we was talking about 3 months ago? I'm starting to get that a little more often. Now it's urgent because something is going on in your body. So journaling.
That makes so much sense. And it definitely helps. With that, there's actually 2 questions that I thought of as you shared that, because, okay, so disclaimer, this a little side note to my PanCan community. I know at the first sign of chemo treatment related symptoms, y'all be ready to check out. Don't do that. Everything that Shani just said goes into the next questions I want to ask, so y'all understand why you should not be afraid of the chemo related symptoms that you may experience.
Mm-hmm.
As a cancer patient, you are definitely going to get regular labs done. They have to run your labs every single time you are prepped for a chemo treatment or an immunotherapy treatment, because they have to have a baseline, like Raeshon just said, to see if you're making any progress, if anything else is being impacted. And you have to make note of what you're eating around your treatment schedules. Some people are scheduled every week, some are every other week, some are on the pill, so they don't have to be they don't have to come in for the port to be put in and be connected. It all depends. Some are slated for surgery, and then that has its own separate protocol in itself.
Right.
So with what Shani just shared, what I would like for you to express next is, how do you understand your labs when you get them to the phone? So you mentioned before, your labs can be done now before you go to your doctor's appointment. Mm-hmm. Especially for those who get diagnosed with cancer, how can family members help their loved ones understand the ranges? What do those ranges mean? What are those ranges even based off of?
Okay. I would say that, again, let me start by saying everybody is different. And that's not everybody, like together, everybody. It's everybody is different. So the things that are happening within you could be different than the way that they happen within me. Your labs are literally just a segue of what's actually going on within your body on the, oh my God, microbiology level. What's happening within your cells, what's happening within your tissues, all of those things that men actually love. So it kind of gives you an idea of what's happening there. So when you see sodium level of 125, what does that mean? When you see a potassium level of 3.6, what does that mean? And it should have next to it should have your result, and then next to it, it should have in parentheses, the normal, right? What the range of it. If you are experiencing, or once you get those labs, look at the first thing that you want to, normal is normal. Normal is normal. But you want to look at the ones that are abnormal, and they typically will be a different color. I know on my app, they turn up red. So those are the ones that you kind of want to hone into. Even if it is 0.1 of it being within the range, it's going to pop up abnormal on it should. Those are the things that you kind of want to take note of. And those are the ones that you want to ask questions about once you get into your doctor's office. Now, you can use a website just to kind of identify, like, what does this mean? I know that on some apps, if you can touch the lab result, if you touch it, it'll kind of give you a brief description of what this lab or what this number means. Like when they're testing your sodium level, like, why is this number important? What am I looking for? What is sodium control in my body? So knowing, if you have access to that, great. But if not, you can go onto like Google Scholar, or I like Mayo Clinic. I did a lot of my research there when I was in nursing school. And even to this day, if there's something that I kind of need to brush up on or refresh my memory on, because nursing or medicine is constantly evolving. Here we go, COVID-19. Constantly evolving, things just popping up everywhere. So to get myself, I'm a forever student, to familiarize myself with things that are happening, I kind of go to the Mayo Clinic. So you can go to the Mayo Clinic and type it in, and like Ashley started this, we are hypochondriacs. So I want to know everything about it. Like, what does it do? What does it affect? Am I feeling this? And oftentimes, crazily enough, when I was in nursing school, I had every diagnosis. I was like, yep, I got that. Yep. Every time we learned about something new, I had it. But in a nutshell, just, going on and educating yourself about what the basis of this lab is prior to going in and having a conversation with your doctor, getting familiar with the lingo to kind of understand what it is that they may be talking about. Just like Ashley said, when I said that long word, she was like, break that down. It's okay for you to ask them, what does that mean? They should be giving you information in what is called layman terms, because as discussed last time, this is a total different language. And if you aren't fluent in medicine, you have no idea what they're talking about.
Even as medical professionals, when we have to go in, it's like, what?
Let me break that down. Okay, you said itis, that means inflammation of. You said chole, I know that that's dealing with my gallbladder. So cholecystitis, that's something dealing with my gallbladder. Okay, cool. But that's how we break it down, because we understand medical terminology. But if you don't have that, you're gonna be like, chole, what?
Right. And y'all, my level of hypochondriasm makes me go stupid. So I will know stuff that they're saying and not know it, having a conversation with them, because I'm so worried and I'm expecting the anvil, like Tom and Jerry. I'm expecting something to fall and hit me on my head. So all of my knowledge and education goes out of the window when I'm in the doctor's office. It's not until I leave and I've processed everything that I'm like, you really didn't know what they were saying. But like Shani said, the average person is not out here just studying these terms. So have them talk to you like you're a 5-year-old. They should be able to explain their knowledge at the level of a child so that it's as clear as possible. And that's totally fine, because no one's going around just saying these words in regular conversation just because. So
Unless
even as
you're me. No.
right, right. So even as medical professionals, we ourselves, as Shani explained, have to not only keep up with what's happening in medicine, but we have to make sure that when we go in, if we happen to be on the patient side, that we're asking them to still break down some things, because I do get that complaint a lot from families that I talk to, where they are sick and tired of being spoken over. They, the lingo is over their heads. They're not taking the time to break the language down. And so I really wanted them to be educated on how to understand their labs ahead of time. And like Shani expressed, look up the word.
Yeah. Ask them, how do you spell that?
Right. How do you spell that? Something I remember one time when I started getting labs on my phone, I said ferritin. Because because as a science major, it's just iron and platelets. They don't make it deep with the terms for us. So it's just iron and platelets. So I was like, ferritin. I had to look up what that meant and then understand that that's tied into understanding iron deficiency. And I recently learned from an oncology provider that low iron should be looked at as a risk factor for cancer.
Yes.
What type of cancer? I don't know. But now that's something that I have on my radar to be more attentive about my iron levels.
Yes.
So just something like that, something as small as that, right? Just that little bit of information takes you a step further in how you can maximize your time at your doctor's office. And then it goes back to, like we mentioned in the last interview, when you talked about the importance and the significance of keeping patient numbers low, right? They don't want you to have to keep coming to the doctor. You don't want to go to the doctor. They don't want you to have to come to the doctor. So being informed and using Google the right way, not using Google to diagnose yourself.
Right.
Because symptoms are not the full story. They're just data.
We're painting a picture.
We're painting a picture, but we have to be private investigators. That's what medical providers are. We're nothing but private investigators Once you give us the picture, if we're good detectives and we ask the right questions and you come in telling us what we need to know, then we can paint the right picture and we can do a further investigation with the tests that are ran. Because contrary to popular belief, every test that they ask for does something different. When
Correct.
you get your blood drawn, there are specific tests that are done to find specific things. It's not a generalized blood panel. That's not how that works.
No.
So, Shani, would you like to rein in on that more?
I would actually. First things first, don't lie to your medical professionals about what you are experiencing and when it started. I understand that sometimes it could be a little uncomfortable to have these conversations when there is another loved one in the room or something like that. It is okay for you to ask them to step out so that you can give the complete picture to your doctor. Like I said, we're painting, or your medical professional. Like I said, you are painting a picture. So if you just tell me that it's blue, then I'm just going to think it's blue. But if you go into the color, like it's blue with a little green and a little this, then I could say, oh, that's teal. That's a total different diagnosis than what I'm going to give you or point to when it's blue. So don't lie to us. Tell us exactly what's going on with you, as uncomfortable as it is. uh for instance, you could eat, the children like to eat all this flaming hot stuff, and so that could come out in your poop, like we were talking about poop earlier. So now you have red tinged poop. But if you just ate flaming hot whatever, because it's happened with my kids, oh my god, mom, I'm bleeding, I'm like, no, you had the red stuff, so it's coming out. So then what I did, instead of just being like, wavering it away, I said, stop eating the red stuff, the flaming hot whatever, and then check it again. If you still notice it, now I know that it's not the flaming hot stuff, but she probably actually does have a GI bleed or something going on. Paying attention to our bodies. So number one, just honing in, don't lie about your symptoms. And then there was something else that you were saying that made a lot of sense, about the like ferritin. That is another lab that is tested, and those levels can indicate that there's something going on and provide another level. I mean, like it, I'm doing the motion, but my frontal lobe's not working.
Like an alarm.
Yes, thank you. An alarm of something going on within your body that could lead them to kind of going down a different path to say, hey, I like to think of things, the way that I studied in nursing school was that I thought of things that made sense to me, right? So I like to look at our bodies as, for instance, let's say a video game or something like that. That alarm that's happening in your body is the cancer saying, I'm over here, or the problem saying, I'm over here. And it kind of gives the doctor or the medical professional a different way of saying, okay, let me see. Because it could lead into maybe, most people want to jump right into a CT scan, an MRI, ultrasound. They want to jump into all of those things. Insurances are not going to pay for those right off the bat, because why? They're expensive. So we start with labs, which is the basis and gives us a baseline of where we are. Now, if these markers or these numbers keep signifying something different, now me as a medical professional have the right and I have the information that's needed to present it to your insurance company to say, this is why I'm doing this test. Don't get me wrong. You do have some doctors that are out there that just test for stuff. Why? Because I get some money back, or I can test for this. And you want to be aware of those types of doctors. It is also okay to say, well, why are we doing this test? Because if they can't prove why they did it, then like we said last time, the hospital wants their money, but so does the insurance company. So when somebody's not paying, it's going to be you. Be an advocate for yourself and ask questions as far as like, why are we doing this test as well? Take your notebook, write it down, ask for the spelling, get an understanding prior to you leaving the doctor's office.
Thank you for sharing that. That just made me think about a practical illustration for everyone who is tuning in. My dad, out in addition to him losing the 10 pounds out of nowhere and the vomiting and the pain. So a lot of the symptoms I named, he did experience. He already was type 2 diabetic, so he didn't have a random onset of diabetes. He didn't have jaundice. I don't remember there being an issue with his urine or his stool. It was just the pain, the vomiting, the weight loss. Also, because we're talking about labs and understanding ranges and definitions of terms that you see when you read those labs, my dad's blood sugar range was abnormal.
Mm-hmm.
It was so abnormal that when he told me his numbers, he was like in the 600s or something like that. Now,
Ooh.
if Raeshon is reading something like that, if let's say my dad had his labs done and they came to Raeshon, Raeshon's going to see that and she's going to look at him and say, well, sir, you should be in a coma. Because
Are you
those
feeling
are the
okay?
ranges for
I would
a
say, oh,
diabetic.
you a little sweetie. That's what I
Yes.
call my patients who got high blood pressures. I mean high blood sugars. I'm like, oh, you a little sweet today.
Yes. Now, the interesting thing, like Raeshon said, we're going to be looking like, are you okay? My dad was walking around fine.
Asymptomatic.
Asymptomatic, but his range was diabolical, as the young folks say today. It was crazy. And I was like, sir, you should be in a diabetic coma. Those numbers are way too high.
Right.
And like Shani said, because he had a wonderful PCP, I loved his PCP. Phenomenal physician.
Mm-hmm.
She went through all the things. She knew my dad liked to dabble in a little sweet, so she asked him, what have you eaten? This man, Lord, had like a box of donuts. Why are you eating a box of donuts? Was my dad healthy? Yes. Did he eat healthy? Yes. Did he exercise regularly? Was he regularly active? Yes. But that sweet tooth runs in the family. My God, today help us all. So he had himself a box of donuts because he just had a craving for them. He had not been eating them over a month. It was just within that week. So she was like, don't eat no more donuts. Come off. Stop. He does that. She was like, let me put you back on metformin. Let's
Mm-hmm.
see if that lowers it and what's happening. Well, he did those things and nothing changed. So now we know it's urgent. And because my dad's blood panel markers were not showing, because some pancreatic cancer patients they experience their blood panels in normal ranges. So your white blood cell count may not be out of a normal range yet.
Right.
Your levels may be reading as normal. And that was what was happening with my dad. He was having these symptoms, but his blood panel was coming back at his normal baseline.
Mm-hmm.
That's what alerted her to say, we need to run a CT scan.
Right.
So to Raeshon's point, ask all of the questions. Ask why they want to, if you have a doctor that's just leaping at every test, no, every test has a purpose. So many times we're like, well, why didn't the doctor do this? Why? And there's some place for that. There are some doctors, I'm like, they didn't run such and such and such. Why? Why didn't check for X, Y, and Z when they know this X, Y? And this is also why it's important to know your family history. Now, for some of you, you're like, I didn't find out my family history until after the fact. That was the case for me. I had an aunt to pass away from pancreatic cancer when I was 13. My dad passed away from pancreatic cancer when I was 30. So that's a 17-year gap.
Was your auntie your paternal auntie or your maternal auntie?
She was my maternal auntie. So
maternal
now no, my paternal auntie. She was
paternal.
My paternal auntie.
Okay,
But
so then that's on that side. Got it.
Yeah. So she was on my dad's side of the family, but maternal in the sense that they share a mom, not a dad.
Oh.
So you can understand my confusion. Because I didn't find out that my aunt passed away specifically from PanCan until after my dad passed. I knew she died of cancer because I was around when she was going through treatments and I was around for you know, what that looked like. So I remember going by her house often and visiting her and how that impacted her body, how it impacted her family. Never knew what type it was.
Okay.
When I found out what type it was, then my mind got to going and I said, well, they got two different daddies. So if it's hereditary, whose line? And so now I want to know about my grandmother's line, but I have no way of learning that now.
Right.
We also have a cousin on the paternal side who passed away, but I know what her risk factors were. So I can paint the picture and guess like, okay, the 100% that's probably what caused hers.
Right. Right.
There's visible risk factors. For my dad and my aunt, there are no visible risk factors. So I have no idea why they ended up with pancreatic cancer, although I have a theory personally about my dad. I believe that my dad, being a pastor, which is a high stress career, caused his type 2 diabetes. And because there is a direct correlation between type 2 diabetes and pancreatic cancer, I believe that my dad's body just over time developed so much stress internally that it led to that.
Correct. That
That is my theory.
makes sense.
And because we don't know if it's hereditary, although there are several cancers that have happened on my dad's side of the family. And so me and my sister have talked about getting genetic testing done so
Yes.
that we can learn what our genetic makeup is and what we're prone to. We want to make sure we don't have any genetic mutations because there are genetic mutations that have a family of cancers related to it.
Yes.
So something that our viewers should know is that pancreatic cancer, if you have a genetic mutation, is also closely related to the mutation that causes breast cancer and lung cancer. And there's a few other cancers, but those are like the main two, which altogether they make up to the top 3 cancers that can kill. So it is important for you to know information like that. Are you a BRCA1? Are you a BRCA2? Do you have a KRAS mutation? Do you have a family syndrome that makes you prone to that mutation that then makes you at high risk for these cancers? Does this mean you will be diagnosed once you get genetically tested? No, it does not. You have many who have gotten genetically tested and they found out that they are at risk, but it does not mean that they will be diagnosed with it. So just be calm, take a deep breath. It's information, it's data. So these are the things that are important to know. And so as we head toward wrapping up our time together today, Shani, is there anything else that you believe our viewers should know that would help them with their 20 minutes?
With your 20 minutes, again, just mark it down. 1, be prepared. Request, if possible, for you to have your labs drawn. Is there, you can ask when you're making the appointment, is there any labs that the doctor would like for me to have done prior to our meeting together? So that way you can have your labs drawn. 2, once you get your lab results back, look for the ones that are abnormal. Do a little bit of research on what the normal range is or what that means in your body, but don't insult your doctor's intelligence by going in and acting like you already know what needs to be done and you need to run a CT scan and you need to run an MRI and you need to do this and you need to do that. Like Ashley was saying and when she was speaking, that there are levels to it. So your basis is that you are going to have labs drawn, which is a blood test typically. So let me break it down. When we say labs mean blood tests. When we say tests, those are more like your diagnostic tests, or they could also say tests with labs as well, but your diagnostic tests like CT scans, MRIs, ultrasounds, all of those things. Those things typically are done after you have lab results done. So that way it is a confirming situation. This is what the labs kind of signify. Again, that alarm is going off in your body. Those are the labs. The CT scan, MRIs, ultrasounds guide us to which way that we should be going. So you might have what's called a KUB, a chest x-ray, all of those things, different areas and different portions of your body to let us know, or to let us know which way we should take. Because if I do, the alarms may be leading me to gastrointestinal, but they could also be leading me to lungs. Because like we said, these lab results could mean a variety of things. It could mean pancreatitis. It could mean that word. Something dealing with your gallbladder. It could mean all of these things, but the way that we could confidently diagnose it is by using these things. Sometimes we could look at it playing charades, right? I have this, I have that. The doctor's like, definitely is this. Why? Because there's one specific thing that you said that makes us say, okay, this. Like a heart attack. If it radiates to your right arm, we're like, oh, chest pain radiates to your right arm. We're like, oh, okay, maybe you got gas, maybe you got this. But if it radiates to your left arm, then we're like, STEMI. Oh no. So, saying all of that to say, make sure that it's a marker. It is definitely just a marker that lets us know I am here. What else? Ask questions and then clarify. Once you get the answer and you have an understanding, you and your doctor develop a plan together, being open to the things that you are willing to do and what they're asking you, because you don't want to be considered non-compliant. Now, again, I get it. There's some things that's just like out of the question. I'm not doing that because it is going to be a risk. The risk outweighs the benefits. I could understand that. But when you say, if that is the case and you're telling that to a medical professional, make sure that you are able to identify and explain why you are saying no to the plan that I am giving you. If you just say, no, I'm not going to do that, then I'm just going to document, this is what I tried. This is what's happening. This is what they said. So yeah, I think that's pretty much it of getting your full 20 minutes is going in informed, slightly informed, and then coming out with a plan as to where to go next. So that way you're not confused or confuzzled about where to go with whatever it is. And you can kind of rest and have a little bit of peace, paying attention to whatever it is that was concerning. You're not like freaking out every time that you get this pain. Now, if you get this pain, yes, please do something about it. Go to the emergency room. So that way it can then be marked as this is something that is consistently going on. Documentation. Not only are they doing their documentation, but you should be doing yours as well. So journal. And that's that.
Amen. Thank you so much, Shani, for being with us again. I know y'all love Shani just as much as I do, so she will be back. And with that being said, if you are tuning in and your loved one has anything close to what we've described, or maybe they've already been diagnosed and you're at the start of this, I do have a free guide on my website that has questions you can ask your medical provider going into your appointments if this is at the very beginning your loved one just got diagnosed with pancreatic cancer, and let those questions further spark any more questions you have. If your loved one is fortunate enough to not experience those things, we hope that you have gained a lot and now you are fully informed and educated as to how you can better maximize your time at the doctor's office. And hopefully it's just a wellness checkup and that's all to it. So if you have any questions for Shani or myself following this episode, please drop them down below in the comments. We would love to answer them on the next time we meet. And we will see you all again soon. Bye.
Thank you so much for watching Beyond the Diagnosis Part 2. Raeshon and I had so much fun with this one, and I hope you are walking away feeling more confident and more prepared than you were before you press play. That is always the goal. If this conversation helped you, please subscribe, leave a comment below, and share it with every caregiver and family member who needs it. We cannot wait to bring you more conversations like this one. Subscribe so you don't miss what's coming next. See you then.